A U.S. government panel now recommends that women start getting mammograms at the age of 40, and continue to get screened for breast cancer until age 74. The U.S. Preventative Services Task Force lowered the recommended age by 10 years from 50 to 40. And the group has said women should start at 50, but now they're saying, listen up, start at 40.
So why the change? We're going to find out. Dr. Greg Marchand is a board-certified OBGYN and a cancer survivor. Welcome to First Edition.
Thanks for having me.
So, Doctor, please explain to us what the thinking is behind the U.S. Preventative Service Task Force change.
Well, this is the most major change by the U.S. Preventative Services Task Force in recent years, changing the starting age on mammograms from 50 to 40. This is going to have huge impacts on the United States healthcare system, essentially immediately. It's going to change that essentially all insurance plans are now going to be required to cover mammograms starting at age 40 with essentially no copay. And it's going to change standard of care for primary care in the United States, essentially setting a new minimum level of care that's going to need to be performed by all primary care providers in the United States for preventative care. And this really came on the tails of a lot of data that was released. But most recently, it was a major study out of Washington University that showed specifically in this age group, meaning women under 50, over the last 20 years, there's been about a 4% increase in breast cancer. And unfortunately, a lot of these breast cancers in these younger women have been found at later stages where it's impossible to treat or more difficult to treat. So I think that was really the impetus for the United States Preventative Services Task Force to go ahead and make this change and make this the new standard.
Doctor, are there certain groups of women who should start earlier? And if so, what are other preventive measures women can take?
Absolutely. So you really want to be on the lookout for anybody that has a first-degree relative, a sister or a mother that suffered from breast cancer. And we certainly want to start screening them earlier. There's a bunch of different guidelines, but as a general rule, we want to start screening about 10 years before you reach the age that your first-degree relative was diagnosed with cancer. In addition, people of lower socioeconomic backgrounds and African Americans are going to be more common to have breast cancer. So it's very important that those groups practice self-breast examination. Every woman should be practicing some form of breast awareness, knowing their own breast tissue so that if there's a change, if a lump appears, if that lump stays around for more than 2 weeks, you can know and you can bring that to a physician as soon as possible.
So it's really important to know your family history and ask mom or your sisters what's going on, right?
Absolutely. Breast cancer is the second most common cancer in women behind skin. It's unfortunately the most common cancer cause of death in women behind lung. We're talking about 310,000 new cases a year. Fortunately, 42,000 of those women will die of breast cancer. It's going to affect 1 in 8 women. So this is definitely something you want to talk to your family about. And if you do have a strong family history, consider getting the genetic testing that can tell you to a better degree of detail what your risk is of getting breast cancer in your life.
Are mammograms enough? You know, I hear that some women have unusual breasts, dense breasts, and maybe in addition to a mammogram, they may need a sonogram or something else. Can you tell us about that?
Absolutely, you bring up a very good point here. It is going to be determinant on what your breast tissue density is. So it's important you talk about that with your provider. In many cases, it does make sense to go ahead and order the mammogram and the ultrasound at the same time to get them both done. You'll have to talk to your provider because there's so many different categories of risk. But certainly starting with a mammogram is not a bad idea. The radiologist can then recommend any other studies that are needed, such as a breast ultrasound or a targeted MRI of the breast if it's needed. Radiologists generally in the United States do a very good job of making sure they get the images they need to pick up breast cancer or anything suspicious for a breast tumor at the earliest stage possible.
You know, doctor, we're talking about mammograms, but you also mentioned skin and lung. And I'd like to throw another cancer in there that actually took the life of my sister-in-law, colon cancer. She was diagnosed. A lot of people don't get these screenings, and she passed away. And 4 months after after she was diagnosed with colon cancer. So there should be a list provided to women, men, everyone to get these type of screenings, to take a proactive measure to try to catch it early, so that way it will prolong many people's lives. What's your thoughts?
You're absolutely right, and that is the main focus of the United States Preventative Services Task Force. Unfortunately, though, there are so many cancers which we still do not have a good screening test for. For example, ovarian cancer is a horrible killer of women, and we still don't have a good screening test for that. Unfortunately, I'm very sorry about your relative, the colorectal cancer we do have a screening test for. It is important that everyone is talking to their primary care provider about getting that colonoscopy starting at age 50. Although colonoscopy is the recommendation, for those that might be afraid of colonoscopy, please don't hesitate to go in, talk to your provider. There are some other options that can be used to pick up colon cancer other than colonoscopy, although colonoscopy still is the standard. Colorectal cancer, along with breast cancer and cervical cancer, are a few of the only cancers that we actually do have screening tests for at this time. Hopefully more effective screening tests for more cancers are on their way.
Well, of course, there's the CT scan for potential lung cancer, and lung cancer is the largest actual killer of women, correct, doctor? Lung cancer?
Yes, certainly patients with a history of smoking, it's very important to make sure that your practitioner knows that. And while we don't have a lung cancer screening guidelines for everyone, there's no magic test to tell if you're going to get lung cancer. We do practice those screening guidelines, CT scans or x-rays of the lungs on people that have a significant smoking history. So please don't hide that history of smoking. If you're a little ashamed of it, make sure your practitioner knows that so we can get you into that screening protocol and catch any lung lesions before they get any bigger.
You know, doctor, hearing you go through all these different cancers, the screenings and so forth, it sounds like the best way to say no to cancer is to be in the know. And the only way to be in the know is to focus on preventive measures.
You're absolutely right. Preventative care is so important. Talk to your family, talk to your friends. Is everyone up to date on their preventative screens? Has everyone seen a doctor this year? It's something we put off in our busy lives, and it's something, as you pointed out, we really shouldn't put off. Cancer, unfortunately, will strike a very high number of Americans, and it's important to catch it as soon as possible to have the maximum chance of survival. So if you're late for your annual exam, please go ahead and see your provider. There is no American that shouldn't be seeing a doctor at least once per year.
Really important information.
Yes.
CT scan for lung cancer, mammograms for breast cancer, colonoscopies for colon cancer. We've got a list now, a checklist. Thank you so much, doctor.
Thank you for having me.
Up next,